Welcome back, everybody, to another episode of Explain This. I'm with the star of the show, Robin Riddle. Robin, what's going on?
Not much. How are you?
I'm wonderful. We've got a very popular topic today.
Yes, we do.
We talk about this all the time, and we're going to go into the details of it today. And I'm talking about pellet procedures. We talk a lot about pellets, not a ton about the actual procedure.
Yeah.
So first, tell me what a pellet is.
So pellets are one of the ways that we do hormone replacement therapy.
Okay. Yep.
So they're little pill-looking things that are inserted into the hip, and that lasts for anywhere from 3 to 4 months for women, maybe 4 to 6 months for men.
Okay.
So pellets are very popular in our practice. We have tons of people that love them. But for someone who's new to pellets or coming into a new provider who's never done their pellets before, I see a lot of anxiety around this.
Sure.
I mean, it is a procedure. There is a small incision. There's numbing medicine. So there's a lot of anxiety for some people. So I like to put people's mind at ease so that they know what they're coming into and what they're getting when they come to me for pellets.
Love it. So this is it's a minor procedure. Mm-hmm. Kind of walk me through how you go about it. Like what's your process?
What's my process? Well, first, before you come in for pellets, I like people to either be off of or at least decrease like aspirin, fish oil, things like that. Anything that's going to increase bleeding.
For how long?
A couple days pre-hand.
Okay.
Probably one of the worst I've ever seen was somebody who took a couple of the goodies powders the day before they came in.
Okay.
We had some bleeding.
Yeah.
It's preferable not to have that on board, just for bruising purposes afterwards, and it makes my job a little bit easier. So, okay. So you come in for pellets. I'm down here in the Knoxville office, of course. We have a fabulous new bed that we get you set up on. We pick which side we're going to put the pellets in on. They are going into the hip area, so we lay you on your other side. I mark the area, prep it, clean it, put a sterile drape over everything. I like to play music during my pellets because we're hanging out and it makes me more comfortable, and I think it makes the patient more comfortable. So know what kind of music you like, because I'm going to ask you.
Yes.
Put a speaker in the room, crank some music up, we get started. My whole thing with all of it is keep you distracted so you don't really realize what's going on.
Yes.
It needs to be an enjoyable thing.
Yes.
So numbing medicine is the first part of it. I am the queen of numbing medicine.
She is not shy with the numbing medicine.
I am not. I hate anything needle related when it's coming at me. Huge anxiety with that. So I understand how people feel. I want you to feel absolutely nothing once I actually start the procedure. So lots of numbing medicine. That's the worst part. That should be the only part that you feel with it. Initial stick and burn, lidocaine burns. It always does. There is nothing I can do to take that away, but I do push it very slowly. So as it goes into the tissue, it's numbing. We have to numb the whole track. So for females, it's a single track that we do for pellets, just a straight down, straight back.
Okay.
For males, it's multiple tracks to fit all the pellets in because males get more pellets.
Okay.
On average, maybe anywhere from 6 to 10 pellets going into a guy, and they're bigger. They're like a small Tylenol versus 2, maybe 3 small pellets going in for a female.
Got it.
So multiple tracks. So I'm at more numbing medicine and numbing in more directions for a male pellet.
Okay.
Then, and here's the key, I let the numbing medicine sit.
Okay.
At least 5 minutes.
So you put the numbing, their back in the exam room. You numb their hip area.
Yeah.
And then you let it sit for
Then
5 minutes or so.
I have to be patient. That's the hardest part because it's so easy just to want to dive in. The numbing medicine works better if you let it sit for a few minutes.
Okay.
So 5, sometimes up to 10 minutes. If I've got somebody that's really antsy about it, I'm going to put a ton of numbing medicine in and I'm going to let it sit for a full 10.
Okay.
Because by that point, when I come back, you're not feeling a single thing. Then I come back in to it and put more numbing medicine in because I love numbing medicine. So I do a little bit more topical numbing then. That also lets me know that the patient's not feeling anything. Then a very small incision, just a tiny little scalpel, small incision. You don't feel it. And I double and triple check before I do that.
Okay.
And again, women versus men, a little bit different. Men, typically the incision's slightly larger just because the trocar, which we're using to put the pellets in, is a little bit bigger in diameter.
Okay.
So slightly larger incision. Go in with the trocar, which is what creates a channel for us. Drop the pellets into it, push them off. For men, I'm doing that in a couple of different directions. For women, it's one and done, just straight down, drop them in, pull it out. Pull that trocar out once all the pellets are in, hold pressure. Usually it's not much bleeding. Usually it's just a slight bit of oozing. Hold pressure. We're just chit-chatting and hanging out. I'm trying to, again, keep people distracted the whole time.
Honestly, it doesn't sound like like, a lot to be anxious about. Like, it sounds like it's pretty straightforward.
Yeah.
It's in terms of the amount of time, what are you thinking? 20 minutes, 30 minutes?
Mine take a little longer just because I let people sit with the numbing for so long. The actual, like, once you make the incision and get them in for women, I am done in a minute or less as far as get them in, drop them. Add to that the 10 minutes that I've let the numbing medicine sit. Men are a little bit harder. Let's be honest. If you've got a little cushion back there, it's going to help me a lot. Men tend to just have more muscular hips, where women have a little, more of a fatty layer there. So that's another thing that makes women a little bit easier. So men can take me a few more minutes. So, and just getting all of those pellets in there.
Can I ask you a little bit about post-procedure?
Yeah,
because
absolutely.
I know there's some protocols.
Yeah.
What are some best practices in terms of, they leave here, what happens then?
Well, one thing on that depends on how I've closed it up.
Okay.
So 98% of the time for women, I'm going to hold pressure till the oozing stops. I'm going to put steri strips across it, put a tegaderm on it, and they're good to go. Men, I do a lot of steri strips in men as well. Some prefer stitches. Reasons to stitch would be if you have a job that you can't avoid lifting, because that's one of the post-procedural things. So if you can't avoid lifting, won't stop working out for a couple of days afterwards, or you're just concerned, I can always throw a couple stitches in there. Okay, so post-procedure, most of the time doing steri strips. You can shower, but no soaking in tubs until that is completely healed. Steri strips stay on until they fall off, which is generally about 5 to 7 days. No heavy lifting for at least 3 days. I'd prefer it to be 5. No lower body exercise as far as lunges, squats, anything that's going to pull that back open. I'm not super worried about the pellets actually coming out because they're that much further down laterally, not down this way, but like laterally.
Right.
I'm not super worried about that, but we don't want to pull that apart. We don't want bleeding. We don't want the scarring that comes with that. So we just want to take it easy for a few days. So no hot tubs, pools, swimming in the lake, anything like that. So something to think about if you're doing pellets in the summer. For about 5 days. We want that completely healed up. So if you're doing pellets in the spring or summer, or if you're going on a trip somewhere, keep that in mind. You can't do your pellets and go be sitting in a hot tub the next day.
Got it. And I think the time period's different for different people, but
it's
not a super frequent procedure. Am I right?
Right. So generally women make it 3, maybe 4 months on their pellets, depending on how their body metabolizes the pellets. Men, I see anywhere from 4 to 6 months, again, depending on their metabolism. Okay. So it's not like you're doing it every month or anything like that, but time your pellets well around what your other activities are going to be, because I am going to want to limit lower body exercise, limit lifting, limit open water sources until that skin is healed up and closed.
Are there any absolute best practices before they come in here? I know you said stay away from aspirin, anything that might cause excess bleeding. Anything else in terms just in getting ready, because make patients feel a little more in control?
No, just being, be calm.
Yeah.
Be calm when you come in. If you've got your muscles tightened up and you're all anxious and nervous, it just makes it slightly harder. Yeah. So just be calm. Realize I'm not going to hurt you. My whole goal is for it not to hurt. If for any reason anything was felt, I stop. We do more numbing. I'm not one of these like, oh, it's almost done, let's just push through. No, I don't want anybody to hurt when they do this. So
amazing.
Yeah.
Guys, get your playlist ready. You can call it the Pellet Playlist on any Spotify, Apple Music.
I'm Pandora, and apparently I was told yesterday I'm bougie because I use Pandora. I'm sorry, I didn't know that was a thing.
Come on, you gotta get on Spotify.
I have Pandora Premium. I have no commercials. I don't like commercials. They interrupt the vibe. So I could maybe get on Spotify.
So come in with your favorite Pandora station.
There we go.
Robin will get that set up, and it'll be easy peasy.
Yep, absolutely.
Guys, you name it, we explain it. Today we've been talking about pellet procedures. We certainly appreciate you guys hanging out. As always, we will see you guys next time.
Don't go away.